Singapore is stepping up its fight against Kpods, drug-laced e-vaporisers that have driven a year of crackdowns and tougher laws. The devices, often containing the anaesthetic etomidate, have fueled a surge in enforcement action, even as around 30 users are still caught each day. Now the response is widening to disrupt supply, while expanding treatment and mental health support to curb addiction for the longer term. Aslam Shah reports.
Toy base. Oh, it's quite scary, isn't it?
No, these aren't festive gifts. They're e-vaporisers, and some are laced with drugs.
Vape distributors are always trying to get one step ahead of the game, and they've been very creative in trying to start up ways to get people hooked and addicted to their devices. I think that's the scary thing, is that as long as they are able to get one step ahead of all of us, we will always be playing this cat and mouse game.
And that game, chasing the latest information, is crucial, with products evolving and coming from different parts of the world. Professionals like Dr. Phua are working with overseas counterparts to share intelligence and best practices to keep pace with a fast-evolving drug landscape.
The literature is trying to catch up with whatever is available in the market around the world. So it's difficult to conduct research when the device itself is different, the contents is different. So both the harms associated with this can be different from one device to the other, and how you stop people from vaping or how to quit also may differ based on the contents within the device itself.
Authorities have tightened the net this year, from amnesty bins like this that let users dispose of devices without penalty to sting operations as tougher laws kick in. Now, with the new regime in full force, agencies and community partners are widening the response to keep up with the evolving threat. At St. Andrew's School, boys learn about the risks of Kpods through assemblies, counselling and peer support. The school works with parents and encourages students to make safe choices and speak up if they notice worrying behaviour. Schools and institutes of higher learning like where I'm at are now moving past just tackling vaping and are focusing on supporting students develop healthier coping habits. Beyond harsher penalties, it's really about helping learners open up, seek help and find more sustainable ways to deal with day-to-day pressures. Dealing with addiction is not just about enforcing rules. It also involves teaching skills to prevent substance misuse and providing mental health support. Through educational materials and advocacy events, the Institute aims to ensure students make lifelong decisions to say no to substance abuse.
The issue about vaping is not ending. It is probably just the beginning. Right for today is vaping. In the future, it might be something else. I think for us, from the Education Institute, it's very important to ensure that our learners are equipped with the necessary skills and make important decisions and important choices in their lives, because they also need to know that such choices can impact outcomes or consequences in the future. And we want to make sure that they do it with an open mind.
Together with other institutes of higher learning, they're working with the Health Ministry on a 24/7 online support portal for students. It's due to launch next year, so help and trusted resources are always within reach. In many countries, vaping is sold as the safer alternative to smoking. In Singapore, it is banned. Yet more people, many of them teenagers, are still getting caught. In just 2 years, the number of people caught possessing or using vapes jumped from about 5,000 in 2022 to nearly 10,000 by the first 9 months of 2024. And now there is a new danger: Kpods, vape pods laced with drugs. We break down how vaping took off here, why Kpods changed the game, and how Singapore is trying to shut this down. Vaping devices first arrived here more than a decade ago through travel, online sellers, and even from friends overseas. At first, laws focused on import and sale, But as vaping started showing up in schools and neighborhoods, Singapore went further. From 2018, it became illegal to possess, purchase or use any kind of e-vaporizer, even if you bought it overseas. The law is strict, but the underground market grew anyway. You can see it in the numbers. About 5,000 people were caught for vaping offences in 2022. In 2023, that rose to almost 7,900. And by the first 9 months the following year, authorities had already caught more than 9,600 people. This year, 1,900 persons were caught from September to November. That is about 30 people every day. Many of them are young. Some studies suggest roughly a third of those caught are under 18. So why is vaping so easy to sell to teenagers? Part of the answer is in how the devices are built and marketed. Let's strip a vape down to its basics. This is a typical vape. It comes in many shapes and sizes, but most share the same core parts. Here's the mouthpiece where the user inhales. This pot or tank holds the liquid, often flavored, sometimes with nicotine. Inside, a small coil and wick heat the liquid into a mist. A sensor and chip detect when you inhale, and at the base, a rechargeable battery powers all of it. On its own, this liquid can already be addictive, especially when it contains nicotine. But the same design makes it very easy to add other drugs to that liquid. Kpods are vape pods typically laced with etomidate. It's a powerful anaesthetic used in hospitals to sedate patients quickly before surgery. In an operating theatre, etomidate is used under strict medical supervision. In a vape pod, bought outside a club or on social media platforms like Telegram, it is something else entirely. Users report feeling an intense, dreamlike high. Doctors here are now seeing the dark side. Seizures, breathing problems, sudden collapse. Some cases have been linked to unnatural deaths and accidents.
You are definitely floating and jamming in your head, but the person in front of you won't be able to realize. But it's not just about how difficult it is. It's about getting your next fix. It's about chasing the next high. So one puff will get you that high. Eventually, one puff will do nothing. Eventually, 10 puff will get you even higher high. And then eventually, 10 puff won't give you anything.
And increasingly, these pods are being used by young adults and teenagers who may not realize they are inhaling a hospital drug. The surge in Kpods forced Singapore to treat vaping not just as a tobacco issue, but as a drug problem, a gateway to serious substance abuse. Singapore already banned vaping devices, but Kpods pushed the government to go even further. From 1st of September this year, etomidate and similar chemicals were classified as controlled drugs, and penalties for drug-laced vapes were sharply increased. For users, that can mean higher fines and even mandatory rehabilitation, especially for repeat offenders. For importers and sellers of Kpods, penalties can go up to 20 years in jail and caning. Foreigners caught vaping can face deportation and bans from re-entering Singapore. The message is clear. In Singapore, vaping is not a lifestyle product. It is treated as an illegal act, and in the case of Kpods, a drug offence.